Hi, I'm Dr. Rohrich of Rohrich Nose. Welcome back, helping you become a more educated you. And we are so pleased and honored to have with us one of my incredibly great friends and colleagues, a world expert in oculo-plastic surgeon, Dr. Steve Faigen. Steve, welcome.
Hey, Rod.
You can see.
Thank you, Rod. Thanks for having me.
Oh, it's good. You can see he's in sunny Florida, where we all want to be and live. So, but Dr. Faigen is an incredible surgeon, an incredible human being, and he's a world expert in oculoplastic surgery and also in neuromodulators and in fillers. So, Steve, we're going to talk a little bit about eyelids. So, the eyelids are the key to the soul of a patient. So, tell us what is new about eyelid surgery and what have we been doing wrong for several decades until very recently? And actually, Steve is one of the innovators that really taught us what a youthful eyelid truly looks like, because plastic surgeons, me included, in the past, 15 years ago, we would be taking fat out of the eye. And fat is such an important part of the face. Nowhere in the body do we want to preserve fat more so than in the eyelid. And Steve really was one of the pioneers that helped us to really persuade us to not take fat out. So, Steve, welcome. And so tell us about your vision of the ideal eyelid.
Well, you kind of touched on it. The problem with traditional surgery is it was excisional. We just remove things, remove skin, muscle, fat,
right.
And that was the solution. You look at some of the great textbooks in plastic surgery and even oculoplastic surgery 30 years ago. Those results would be unacceptable today.
Even 20 years ago, yeah.
Yeah, we made people look different 10 years ago. You're right. And, it was like a wow effect, like, look how different they look. And then you go, they don't look anything like they used to. So, just like any other part of the face or the body, I and many others started looking at, okay, what is in a youthful face that we're trying to restore? And a lot of it, as you mentioned, is the appearance of volume.
Right.
And because of volume changes and volume shifts, we create a lot of shadows, just like anywhere on the face. So the excisional procedures not only don't work well or look well, they certainly don't look natural, and they don't restore what the patients had when they were younger.
Right.
So I started looking at where we failed. And it started with the upper eyelids. We used to take out skin, muscle, and fat, hollow out the upper eyelids, and that wasn't a really nice result. And again, they were thought to be great 10, 20 years ago. So you look at young people, they have fullness in their infrabrow region. They have a sharp defined crease. All these things that we frankly destroyed with traditional surgery. And so my early article on upper lid blepharoplasty really changed the way I was doing things and others. And I think it made people think about, okay, what's youthful and where do we want to go and what are we trying to achieve?
I agree. And when Dr. Faigen presented that, and also when you actually did that live surgery, I was in Baker Gordon a long time ago, people were going, oh my God, we don't want to see that. That's really not, and yet it made people look youthful. And all those things that have been published even in our journals made people look older, and actually really old. Because as you mentioned, when you get old, you lose fat, your eyes sink in. And so really it was revolutionary. It changed my practice for eyelid surgery. And so I think, you should be credited for doing that, because less is more sometimes, especially in the eye. I mean, the eye to me is like the nose. You really don't want to screw it up because it's hard to fix. Do you agree?
I agree. And just like the nose and just like the lower eyelid, sometimes the most minimal improvement is dramatic, and it's undetectable. And that's the other thing, just like with good nose surgery, good eye surgery, good any surgery, it shouldn't look like it happened. And yet, we all go to restaurants and out in public areas where we see patients where their surgery is so obvious, and that should never happen. Great surgery, and we'll talk about injectables later, it should be undetectable. The lower eyelid's another issue, which was kind of uncharted territory, and people were just doing excisional surgery, removing skin and muscle, no canthal support, and they forgot the fact that things fail and things kind of degenerate with time. We get involutional changes, and it's a complex process of lower periorbital aging, and a one-size-fits-all approach just doesn't work for most people. So again, trying to derivatize and see where are the issues, and it was lack of canthal support, lack of skin tension and integrity, loosening of the muscle, shifting of fat, and then trying to address all those problems surgically is where I started to change my thoughts about lower eyelid surgery, and that's why I published an article in PRS on retinacular suspension.
Tell us about that. Tell us about that, for this consumer. What is canthal support? Tell us what that means to us as we get older.
Well, interestingly, it's now become even more popular, and we get a lot of requests because the younger patients want that canthal tilt. That's like a new big thing.
Yeah,
they want an upsweep.
Eyes turned up, not the fox look. Yeah.
And in many, that is unnecessary and unnatural. And the whole attempt to canthal support is not to change the shape of the eye. It's to preserve it. If you ask most patients who prevent for eyelid surgery, they're not interested in any change. They want improvement, and they want to not change the shape of their eyes. So when people hear about canthopexy and canthoplasty, they think we're going to change the shape of their eyes. The purpose is to maintain it. And you need to support the outer corner. It's the foundation of the lower eyelid. Yep. In order to do all the tightening that you may need to do and not change the position of the lower eyelid and the posture of the lower eyelid.
Right. And what Dr. Faigen's talking about is this is the outer part of the eyelid. And as we get older, it goes from a more youthful look to coming down a little bit. And really what he's talking about is just bringing this up just a little bit to make it look soft and natural, and also to preserve the eyelid, right? I mean, that's really what you want to do. And not overdo it, because if you overdo it, it changes the person's face completely.
Yeah, and there were, traditionally some canthoplasty procedures were altering. Right. So people have that notion that when you do a canthoplasty, you make people look different. And that the retinacular suspension is not intended to make people look different. Right. It's meant to preserve shape. And yes, temporarily they have a slight upward slant, but that's temporary. Right. I just need the eyelid position to be maintained while they're healing. Once you're in several weeks of healing, the canthal support is less necessary. And even skin flaps on lower eyelids. And we used to make an incision underneath the muscle. It's called a skin muscle flap. And those were what most people did. The problem is you get denervation and you lose nerve input to the muscle.
So tell us about that, because that's truly been another innovation, is that not only do we bring up and just slightly rejuvenate the outer layer, the canthus, but we no longer debulk or denervate, which means you injure the nerve to the lower eyelid, because you need that to blink. It's not like it's a static event. It's not like the nose. If you denervate the eyelid, that's not a good thing. So we've transitioned from skin muscle, which is both, and then to skin only. So tell us about why that is so important.
For a lot of reasons. One, the denervation, as you talk about. If you go under the muscle, you get denervation. And those that are fans of skin muscle flaps say that denervation is temporary. Well, that's true. Usually you get reinnervation, but the damage that it causes while you're reinnervating, which includes change in the lower eyelid posture, sometimes can be permanent. So I've avoided a skin muscle flap for years.
Same here.
Secondly, when you make an incision under the skin, you have the best chance of making the skin look better. When you're in the deep plane under the muscle, you can tighten all you want. You're not going to tighten the skin with a skin muscle flap very much.
So this is not the deep.
It requires a lot of resection. So I like the skin flap for that reason. And thirdly, when you preserve the muscle, you can then use the muscle as an additional support to the lower eyelid. That blending of the lid-cheek junction requires some muscle tightening, and you can do that by keeping muscle intact through a skin flap. And then you have three ways of tightening the lower eyelid. You tighten the canthus, you tighten the muscle, and then you tighten the skin. And it needs to be done in that order to preserve shape and do all the things you need. As I mentioned, lower eyelid aging is so complex, and it degenerates in all three of those areas. So you need to treat each one independently.
Right, and that's how aging occurs different in each of those layers. So this is not the deep plane eyelid surgery you want. I mean,
it's not a deep plane eyelid.
No, I know.
Deep plane eyelid surgery doesn't work. It doesn't.
And we don't know about
we did cheek lifts back in the 90s and turn of the century, and that was a composite lift of skin muscle and everything else.
It was a disaster.
It fails. In most patients, you can't maintain lid posture with elevation of the cheek.
I know, and all those things were disasters, and they're just like we mentioned, a bad rhinoplasty. They're hard to fix. I mean, I know you see them all the time, and you present all how you fix them, but they're challenging. So don't go there. So what does the consumer need to know before they go? Because eyelid surgery, is complicated. People will say, "Oh, it's not." But so tell us about, how do you find somebody that's truly an expert, that's going to give you a lot of these points that you talked about? How do you find somebody around the United States? I mean, if they're not in Florida or Boca Raton,
well, one of the ways to find a surgeon is just by what you've heard in the community, their reputation locally, and certainly if they have a reputation nationally. But people get hung up on credentials, and there are certain specialties that say we're the only people that should be doing eyelid surgery, and it's just not true.
Right.
There are some excellent surgeons, but it's based on their passion for the procedure, their technical ability, and frankly, in the end, their results.
Right.
If you hear about somebody in the community that does great eyelid surgery, that's somebody you may want to consult with and be interested with. However, if you go see them and you don't like anything of what they have to say, they may not be the right surgeon for you. So I don't get hung up on credentials. I know great surgeons in every specialty that do eyelids.
Yep.
And it's just the individual that has a passion for it and then really understands periorbital aging and then how to address that surgically.
Right. And then showing the results. See the results. Not only on social media, because everybody's famous on their own Instagram and website, but showing and see their results. See their results that they consistently show, not only on Instagram, but on the website, because that's the consistency you want to see. I mean, there's no such thing as a perfect bleph or a perfect nose, but seeing that. So if you see Dr. Faigen's Instagram or his website, you can see it's just natural. And I love that recent talk you gave where you just showed how you minimally changed people, and they look amazing. Because it's even more than a rhinoplasty where, eyelid, because that's the first thing you look at. You look at their eyes, their lips, and their nose, and boy, if you screw that up, it just changes people, and it can make them look weird.
Yeah, you make a great point, too, because all three things that you mentioned are so important because they're in the center of the face. Eyes, nose, lips, they're center part of the face. Eye contact. That's why eye surgery, nose surgery is so important, because you can't hide it. It's right there in the open. And so you get a bad rhinoplasty, it's blatantly obvious. Bad blepharoplasty, it's real obvious. And
right.
You can't cover these problems. So I think it's important when you look for a surgeon, as you mentioned, see the results not only pictorially, but in the community. If you see somebody who said, "Oh, I had my eyes done by so-and-so, and they look amazing," that's a good start.
Yeah.
If they look terrible, run.
Right. Now, before we leave eyelids, I want to talk about fillers to the eyelids. So tell us about fillers to the eyelids. I mean, I know how you feel about it, and I feel the same way. But so what, in a younger patient, I mean, what should you know about that spontaneity to have my eyes filled with filler? I mean, tell us about the pros and cons, and there's probably more cons than pros.
And that's my personal bias. I think there are more cons than pros, but it doesn't mean it shouldn't be done.
Right.
And what happens is you have to just pick your patients appropriately. And patient selection is paramount. As you mentioned, younger patients, they tolerate pretty much anything. You put small amounts of effective filler products in the tear trough, it can work very well. Certainly those patients who are not interested in surgery. And remember, all fillers are not the same. Some fillers are a real problem around the eye, and some are very accepted. So I think it's not a procedure that I just do uniformly. Again, it's not a one-size-fits-all approach for
right.
periorbital rejuvenation. So I think you have to pick your patients appropriately, pick your products appropriately, use the appropriate volumes, use the appropriate technique, and you can get some nice results. The problem I see with fillers in general is they're universally applied. And if you put, a 65-year-old, you put fillers around their eye, they already have so much periorbital aging, fillers aren't going to help. And they typically have pre-existing lower eyelid malar edema that you typically will make worse.
Worse, I agree.
So, the most hyaluronic acid fillers are like sponges. They bring water to the area. So I think the ones that are least hydrophilic are probably the most appropriate.
Right. And that all comes down to selecting an injector that knows how eyelids age and preferentially really does this surgery in that area. I see so many of those, and I know you see so many of people that have had fillers, and they're not always easy to quote-unquote melt because like you mentioned, you can get edema or swelling there that can be permanent because you're obstructing those lymphatics in the lower eyelid. So less is more. Use non-hydrophilic fillers. Restylane a good one, for example. But, it all comes down to the injector. It's proximal to the needle. Don't you agree?
Absolutely. I mean, and again, it's bad judgment when usually there's a problem. Not always, but usually. It's just not an appropriate filler, not an appropriate patient. And you get into trouble with these patients. And interestingly, the problems don't necessarily happen right away.
Right.
So you can see someone who's been doing fine, and all of a sudden, months later, they're not. These are patients that usually have a pre-existing problem, or the agent or the technique was inappropriate. So I think it's not a procedure that you shouldn't do. It's a procedure that you need to do with caution and on the right patient. And the problem we're seeing, and the reasons you're seeing so many issues, is because anybody can inject filler around the eye.
Right.
No matter what specialty, you don't even have to be a core specialist. You can be anybody that has the ability to inject patients. They inject filler around the eye because it's such a huge demand for people that want periorbital rejuvenation. So they go, oh, you don't need surgery. We'll just inject your lower lids. And again, a lot of these patients are unhappy.
Right. And it's frightening. I see those patients all the time from med spas and things like that. And, injecting in the eyelid is almost as crazy as trying to inject in the nose if you don't know what you're doing, because you can cause great harm. So Steve, incredible wisdom, great points, phenomenal. Tell us the 5 take-home points for those who are watching that really should know before they go about eyelid surgery and fillers, and how do you stay out of trouble, and how do we find the Steve Faigen in your area, an expert that's going to not only have the passion and the perseverance, but also really is talented. How do you find that individual in your area, or at least seek out somebody that's close to what you've talked about?
A lot of it goes on reputation and what you've seen. But for injectors in general, they have to understand the problem. If you don't understand what the underlying problem is, you have no clue, or you're just guessing what the solution is. And you have to have, once you figure out what the problem is, my second point would be have a comprehensive plan and option. Right. If you want a dramatic result, this may be the approach you might need. You have to educate the patients too. And when I see patients, I know, Rob, when you see patients, they need to understand why you're doing it. I've heard they saw 3 or 4 specialists, and you come up with something that's similar but not quite like the other ones. Why are you doing what you're doing? Give them a good rationale of your approach. The other thing is, with surgery and even with injectables, mark, measure 3 times, and cut, inject once. Right. People do so little planning. I know you look at your patient's charts the night before. I do as well. I want to have a clear mind exactly how I'm going to approach this patient that following day. So if you don't have some clarity of how to approach it, my 4th point is have a clear approach, and then mark carefully, and then the implementation of whether you're injecting or cutting, it's once. You know exactly what you want to do. Right. And then finally, any issues that you see, jump on it early. Whether it's an injection-related issue, you need to treat it immediately. If it's a surgical-related issue, yes, things tend to get better with time, but they certainly resolve better and quicker when you jump on problems as soon as you see them.
That's phenomenal advice. I mean, you really know before you go. I mean, this is such an incredible segment with Dr. Faigen. It'll really, I think, save you when you're trying to find somebody to do your eyelids or actually do fillers around your eyelids, because this is such intricate anatomy. You have to have somebody that exudes the passion that you see here with Dr. Faigen. So know before you go. Please send us your comments, what you'd like to see, what you'd like to hear, and more about Rohrich Nose and all of these things to help you become a more educated you. And thank you, Dr. Faigen, for your incredible wisdom in this area.
Thank you, Dr. Rohrich. Always great being with you.
Yep.